Hi there, I'm Dr. John Caruso, child psychologist, and welcome to another edition of Dr. C's Morning Minute. I'm glad you could be here. Now, as you know, there's been lots of fuss and discussion about the DSM-V and how the diagnosis for autism will impact the autism diagnosis in general. Will it result in less children meeting diagnostic criteria and therefore less children getting the services they need? Is this concern legitimate? Well, let's talk about that today. First, let's talk about the diagnostic criteria for autism under DSM-V. One, we have deficits in social communication and social interaction. What does that entail? Well, that obviously, difficulty in back and forth communication, poor eye contact, maybe even the absence of any interest in sustaining a relationship or interaction. We also have the restricted repetitive patterns of behavior or interests, as well as hyper or hyposensitivities. Now, there's also some very important specifiers for the extent of the severity of these deficits, as well as specifiers for with or without intellectual impairment and with or without language impairment, as well as whether it's associated with a known medical or genetic condition or environmental factor. So you can see that this criteria, along with the important specifiers, which are vital, cover everything from what formerly was called autistic disorder at the more severe end, Asperger's disorder at the higher end, and in the middle, pervasive developmental disorder. So what's the problem? Well, in the DSM-V, there's another, what could be referred to as a competing diagnosis, and that's where there may be some potential challenges. In that respect, the DSM-V has a new diagnosis referred to as social communication disorder. Now, what does this entail? This entails persistent difficulties in the social use of verbal and nonverbal communication, manifesting in, for example, problems with greeting others, sharing information, possibly being overly formal in language, having difficulty following the rules for social communication and conversation, problems with turn-taking, not understanding what is not explicitly stated in the conversation. So this diagnosis would cover those kiddos who may have autism-like verbal and social deficits, and kiddos who don't quite get it socially, but who do not have any restricted or repetitive patterns of behavior or interests. Now, the question is, which DSM-IV diagnosis will be most affected by the social communication disorder diagnosis? Well, let's answer that. At least a portion of the kiddos who would have been diagnosed with pervasive developmental disorder (NOS) will now be diagnosed with social communication disorder. Now, research published in January 2014 in the American Academy of Child and Adolescent Psychiatry found that about 8% of kids diagnosed within the autism spectrum under DSM-IV have subsequently been changed to the social communication disorder diagnosis. That's a far cry from the 20% predicted earlier by the CDC. Most of the children whose diagnosis was changed had been diagnosed with pervasive developmental disorder and were changed to social communication disorder, which is understandable, given that PDD has such a vague criteria. Those who had been diagnosed with autistic disorder or Asperger's disorder under DSM-IV were largely unaffected. Another diagnosis that may be impacted is nonverbal learning disability, which really is essentially the same as social communication disorder. However, given that there has never been a formal DSM-IV nonverbal learning disability diagnosis, now these nonverbal kiddos too will have a better diagnostic fit with social communication disorder. Now, what is the consequence then of the DSM-IV? In summary, it's likely to change diagnosis to social communication disorder for those very few children who will be affected. Generally, though, it'll be positive for those kiddos. In that respect, having seen these children firsthand, they clearly struggle with verbal and social skills, but are not autistic. They don't present that way. Up to now, the diagnostic options have been few besides PDD. These children can still obtain services consisting of individual and group as well as speech and language and outpatient social skill training while avoiding the autism diagnosis. That doesn't quite fit anyway. I hope that helps to clarify the effect of the DSM-IV regarding autism spectrum disorder versus PDD versus autistic disorder versus Asperger's, and of course the new social communication disorder. Thanks for being here with me today. Hope to see you next time.